Hey folks, Dr. Joe Esposito here. Glad to be with us today. What we're talking about today is a kind of a special show. We're going to answer questions that you, the listeners, send me pretty much on a daily basis. And we get a ton of questions on our website, drjoe.com. And so periodically what we do is we kind of break off our usual style of show, and we do a question and answer session, because if you have a question, chances are other people have them as well. So we want to answer those questions for you. If you do have questions that we don't get to today, of course, you could always go to our website, drjoe.com. And we have over 1,500 hours of podcast, audio, video. We have articles. We have blogs. So you can search the website yourself. Just type in what you're looking for, hit enter, and type in, look for what you're looking for. We probably have a show on it or an article or something like that. If for some reason you can't find it, then you could send the question to us, and we will gladly answer it for you directly on the website. And then periodically we pick a few questions and we do shows like this. So it's just kind of fun, and we enjoy shows like this. This is kind of neat. So Garrett, Sierra, who wants to ask me my first question?
What is one thing that you think most people are missing from their diets?
All right. What's the one thing that most people are missing? Wow. If I had to pick one thing, I guess it would be raw food. And this is really important because as we get older, when we're younger, we produce a lot of enzymes, we produce a lot of healing capabilities, and as we get older, our body doesn't heal like it used to. We all know that as we get older. But the one thing that's really missing above everything else is probably the enzymes, because the enzymes make everything else work. So I always look at enzymes as kind of like a matchmaker. The enzyme comes in and makes this nutrient mix with this nutrient, makes it come together, and then kind of steps back and lets the nutrients do their things. But without enzymes, we're nothing but a sack of chemicals. And so people talk about vitamin A and vitamin B and vitamin C and vitamins and minerals and nutrients and macronutrients and micronutrients. But the one thing that hardly anybody ever talks about is enzymes. And this is the thing that without the enzyme, nothing else happens. And so where do we get enzymes from? Raw food. As soon as you cook any food above 110 degrees, whether it's a carrot or a steak, you cook it above 110 degrees, the enzymes or proteins, they start to change their structure and they become non-functional. And so it's kind of like, I remember I had a teacher, Dr. Richard Lord, when I was in college. Boy, was he smart. A big influence in my career, actually. And I remember one of the things he said when he was working on his PhD, he said the question they asked him when he presented for his PhD was, can you unfry an egg? That was his question. And as a student, I thought, what an odd question. But it was really important because you had to understand that when you heat a protein, it changes its molecular structure and doesn't go back to its old structure. So the answer to Dr. Richard Lord's question was, no, you can't unfry an egg because the proteins are what we call denatured or changed. And so whenever you cook food, you change those proteins. And that's what happens when all of us are eating cooked foods. Now, I eat cooked food, but I eat a lot of raw food. In fact, right before I came on the air today, I had a salad. And so I had to pick the salad leaves out of my teeth. And so the raw food is really important to have. Some people have trouble with raw food because it's really high in fiber and it can be irritating to the bowels. If that's the case, that means your bowels are really in bad shape. And so what I'll recommend then is maybe cook your fruits and vegetables and then start adding a little bit of raw food to that periodically until you get used to it again. But if you can't eat raw fruits and vegetables, there's something really, really wrong with your digestive system. So it's not the vegetables and the fruit that's the problem, it's the digestive system, the bowels that are a problem. And then you got to go in there and fix that. Now, at our offices, we work really hard at fixing the nervous system, chiropractic care, of course, pinched nerves, muscles, ligaments, tendons, discs. We work on that and try to repair them. We also work on the digestive system. Because the digestive system isn't working, you can't absorb your nutrients, the body can't heal. So raw food, where do we get raw food? Broccoli, cucumbers, tomatoes, avocados, salad, anything uncooked is going to have enzymes in it. Now, I don't recommend eating raw animal proteins. You shouldn't eat animal proteins anyway. But raw food is going to be the key. So if you're not willing to have a whole raw meal like I just did, I want you to have something raw at every meal. So have a salad with your meal. Have an avocado. Have a tomato. Something raw with every meal. Also, Dr. Joe's Super Greens and Dr. Joe's Essential Source, mostly raw. And the reason we do that is we want to keep those enzymes active. So it's the minimum supplements I believe everybody should take every day are Dr. Joe's Super Greens and Dr. Joe's Essential Source. And they're available on the website, drjoe.com. You can pick them up at our offices. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. And we have other supplements as well, but that's the minimum. That's the starting point. People want to say, Dr. Joe, where do I start? You start with Super Greens and Essential Source, something raw at every meal, and then you could listen to the shows we've done on the 7 Deadly Sins of Nutrition. It's on the website. And we do a follow-up to that called So What Can I Eat? That's on the website as well. So if you listen, if you want to start, 7 Deadly Sins of Nutrition, So What Can I Eat? Super Greens and Essential Source, something raw at every meal. That's what most people need to do right away. That's step one, and then we build from there. So, Sierra, Garrett, more questions?
I have a quick follow-up question. When you were talking about like people who are trying to introduce raw foods into their life,
Yes.
and you said to cook it, do you think like steaming is the best option?
Yes.
Or
Absolutely. The less you cook, the better. Absolutely right. But again, there's very few people that can't eat something raw, but periodically people will say, Dr. Joe, I can't eat carrots, I can't eat lettuce, it just tears up my colon. Then you can...
Diverticulitis.
Diverticulitis, right, irritable bowel syndrome, Crohn's. But what's nice is the Super Greens, the Essential Source, has the benefits of the raw, but we take the fiber out. So you can do that to start to heal the colon as part of the healing protocol until you're able to get to the raw food stage. So.
And that would bypass a lot of the issues that people with even like diverticulitis would have.
Yes. Yeah, because people with diverticulitis say don't eat nuts, don't eat seeds.
Leafy vegetables can be an irritant.
Right. I'm not sure I'm buying all that, but okay, I'm not going to argue conventional wisdom there. I'll just say this is how you get around it. Fruits and vegetables, Super Greens and Essential Source to start, and then you start adding these other things to it. And boy, when you fix somebody's bowels, it changes every aspect of their lives. So they're really happy when you do that. And we do it all the time. So.
Slight switch. What would you recommend for someone struggling with acne or other skin issues? I know we've been getting that question a lot with the increase in mask usage.
Yes, the mask usage especially, yes. Whenever I see a skin issue, I always think digestive system. So it kind of goes back to the colon again, interestingly enough, but more so the liver. But the liver and the colon are directly related to each other because when you eat your food, your stomach, you chew your food, and the saliva has something called salivary amylase. And amylase breaks down carbohydrates. This is why we add a little bit of salt to something that's sweet, like a cake, let's say. You say, why do I add salt to it? Well, the rationale is that salt will cause the saliva glands, the salivary glands, to release saliva, which will release that salivary amylase, which will break down the carbohydrates and make things taste better. So that's why we add a little salt to it. So then it goes into the stomach, and the stomach has other digestive enzymes, but the stomach's main job is to take proteins and break them into something called amino acids, basically dissolve them. Then this slurry passes into the small intestine where the pancreas kicks in, and amylase, protease, and lipase are released to break down carbohydrates, fats, and proteins. And then the gallbladder kicks in, and the gallbladder breaks down fats, and then bacteria in your colon break the food down even further. And that's a normal, healthy digestive system. But what happens if we mess that up, and most of us do, we start absorbing big chunks of undigested food. And these big chunks of undigested food have to go into the blood system, and they have to be taken out of the body. So then white blood cells come along, hook onto the undigested chunks of food, carry it out of the blood, out through the liver, and that can cause liver problems. Now, if the liver's clogged up, fatty liver, the body can't detoxify this junk. And the liver then puts it into the gallbladder puts it into the bowels, and then it passes out. So the liver says, I can't pass it out the way I usually do. What else can I do? Well, I can go through the urine, I can go through the skin, and I can go through the breath, and with women, the menstrual cycle. But what happens is the skin is the second choice. And so it'll come out through the mucous membranes and the skin, so you might have runny nose, bad breath, rotten, a slimy tongue, and then the acne comes along with it. And so many times we have to go working on the liver and the digestive system. So a couple of tips I would recommend. If you're not eating raw food, which by the way you should, if you're not eating raw food, you should also take Dr. Joe's digestive enzymes. Enzymes are what we need, we talked about that question 1, to break down the food. So whenever I eat a cooked meal, I take Dr. Joe's digestive enzymes, and I always take Super Greens and Essential Source every day anyway, because that's the minimum supplements everybody should be taking. But if I eat a cooked meal, no matter what it is, if I eat beans and rice, or if I eat Ethiopian food, I'll have a digestive enzyme. It's on the website, drjoe.com. And I have in my car, I carry them with me, have them in the office, have them at home, and I just pop one. It's amazing how much better your digestive system works when you take a digestive enzyme with cooked food. And that'll help the digestive system works. We'll take the stress off the liver, so the liver doesn't have to detoxify through the skin. So if you have bad breath, if you have acne, usually it's a stomach, digestive, and or liver issue. And digestive enzymes really solve the problem, and eating more raw food. So it's really, it's a very common situation, especially with people wearing masks now, but you can kind of counteract that. And when you do that, the skin is nice and soft and supple. Like, I don't have any wrinkles. And people say, how do you do that at your age? I said, well, I don't do anything special. I just don't poison myself. I don't put bad foods in my body. I don't have any gray hair either. How do you do it? Well, I just don't poison myself. It's not anything special. I don't have any magical skills. So you can do these things very simply by eating a better diet. And if you do have acid reflux, heartburn, burping, gas, bloating, many times that's not a chemical problem. That's a physical problem. Your stomach can be pushing up into your diaphragm. And if the stomach pushes up into the diaphragm, the stomach isn't relaxed and it's not digesting food properly, especially proteins. So you might have burping, gas, acid reflux. Just last weekend, I was feeling good. Everything was fine, but I noticed I was burping a lot. And one of my friends said to me, she said, you're burping a lot. What's with you? And I said, I don't know. So I went into work on Monday. I grabbed Dr. Irwin, one of our amazing doctors that works here at our offices. And he found my stomach was pushed up against my diaphragm. He pulled it back down. Instantly, stopped burping. My throat cleared up. I had a little scratchy throat going on. And my stomach flattened out because I wasn't digesting my food. The food was rotting in my gut. So it's a really simple process. Usually it takes several visits to stabilize it. And I'm at that point now. And then when it acts up, I just need a little tune-up, which is what everyone should do. For chiropractic care, for digestive issues, you need maintenance. You maintain your teeth, you maintain your eyes, you should maintain your digestive system and your spine as well. And that's why when people start with us, we put them on an intensive treatment plan, chiropractic-wise, and then we spread out their visits, and then ultimately, after several weeks, we put them on a maintenance program. And that's where we want all our patients to be, on a maintenance program, and just get a tune-up periodically. And that's really what the ultimate in healthcare, as far as I'm concerned, would be. Now, if we do need medical intervention, there are other things we can do for acne. You can do PRP. PRP is we take your blood, spin it down, and we take out what's called the platelets. The platelets are the growth factors. We take the platelets and we can, in some cases, inject it back into the body. It works wonders in many cases, not all. Arthritis, the knee, the shoulder, the spine, the fingers. PRP is like amazing because it stops the inflammatory reaction. We can add something to it called A2 macro, which then adds more anti-inflammatory cells from your own body. These are not cells from a baby or from an umbilical cord. These are your own cells we're concentrating and putting back into the body. We can do that with acne as well. You can do PRP, mix it with some hyaluronic acid, and use it as a topical cream. So there's a lot of different things we can do with PRP, and we offer that in our offices, and it's just amazing. And I can't imagine why the whole world isn't all over PRP and chiropractic care and nutrition as a primary portal of entry for healthcare. So that gives you a lot about acne, but in many cases, that's what we need. We need to do several different steps. So, you have another question for me on our frequently asked questions show?
Yes, I have another follow-up question for you about the stomach being pushed up in the diaphragm. Can that affect like your breathing too?
Absolutely. Boy, asthma. When I was a football player, I was the biggest guy on my team. They wrote up articles. I was going to lead them to a state, maybe a county championship, maybe the state championship. And I broke my arm week 2 of my senior year. I hit a freshman, broke my arm. And I remember laying on the ground, holding my arm. I'm going somewhere with this. Holding my arm and saying, I broke my arm. And my coach looked at me and my arm was all twisted. And his first response was, who's going to play tackle? That was his first answer. So anyway, I broke my arm, and I still, periodically, it still acts up. A chiropractic has saved it. It puts it back in place. But to answer your question, I was one of the slowest guys on the team. Even though I was big and strong and muscular, and I realized now that my stomach was up against my diaphragm because I had horrible digestion, horrible breath, burped all the time, always bloated. And I realized now, had I known that we can pull the stomach away from the diaphragm, my diaphragm would have moved up and down a lot easier, and I probably would have been even a better football player and a better hockey player, but I wasn't because I couldn't breathe. So the answer is yes, it can easily affect your breathing. And snoring. A lot of times we fix the stomach, snoring goes away. So, more questions on our frequently asked questions show?
Yeah, so this kind of, well, it doesn't really fall in line, but they're all related. What are some simple things that I can do to boost my immune system?
That's a 2-hour show right there. Simple things? All right. Number one, you got to cut out your sugar. Now, you don't want to hear that. No one wants to hear that. But sugar just blows out the immune system. In the second book that I wrote, Prescription for Extreme Health, we talk about how 1 can of sugar can weaken your immune system exponentially. And we have all the statistics in the book. I don't want to make this a whole show now. But you got to cut out the sugar. That's breads, cookies, cakes, donuts, pastas, added sugar. You can do stevia if you want to. I know with the holidays coming, people are asking me, well, what about cookies and cakes and donuts and pastas? Well, there is stevia. In fact, I bought some. I think it was at Walmart, actually. I haven't tried it yet. I don't know if it's any good or not. But it's stevia, and it says you use cup for cup equal to sugar. So I got to try that and see if it works, and I'll report back. But really staying away from the sugar is great. And once you stay away from it for a couple of weeks, the cravings go away. Usually after 3 days, it goes away. So with sugar cravings, we have a program called the 21-day doctor-supervised weight loss program. And you can call the office. It's on the website. And we can get you on that, where we kind of reset your brain. You get supplements, you get shakes, you eat plenty of food, but we kind of reset the brain so you lose those sugar cravings. So that would be step number one. That's proactive. You have to take vitamin D. In the winter, you have to take vitamin D. How often? Always. How should you take it? Everybody. I take 5,000 international units of vitamin D a day. That sounds like a lot, doesn't it? 5 drops of Dr. Joe's vitamin D. It's been shown to help tremendously with the immune system. You want to keep your vitamin C levels up. So if you're eating a lot of fruits and vegetables and super greens and essential source, you should be getting plenty of vitamin C. So that's going to, so the vitamin C, if you do have a scratchy throat, make sure you have zinc lozenges on hand and just periodically suck on a zinc lozenger. If I have a little scratchy throat, I'll suck on one every 2 or 3 hours. So to maintain the immune system, no sugar, very little sugar, vitamin D, super greens, an essential source. Glutathione is really important for the liver. That kind of goes back to the acne question. Glutathione is amazing for the immune system. And then digestive enzymes to help the digestive system work. So on the website, drjoe.com, super green essential source, vitamin D, glutathione, always, digestive enzymes with cooked meals. Let's assume you get a new virus or new bacteria in the body. The body is doing all it can to fight it. It doesn't know how to fight it. The body has to learn how to deal with these things. So what the body does, sometimes you might start to feel under the weather. If you do, zinc lozenges every 2 or 3 hours, suck on them. Vitamin C, I'd recommend 1 gram of vitamin C a day. Make sure it's pure vitamin C and not ascorbic acid. If it bothers you because it's too acidic, you can get a buffered vitamin C, or better is a liposomal vitamin C. I can't find them in any stores. I got to get them online. Liposomal vitamin C, and that's easy on the stomach. Gram of vitamin C an hour. You'll probably get loose stools from this. And then 50,000 international units of vitamin D. That's just 50 drops for 3 days. After 3 days, go back to 5,000 international units. Okay? So 50,000 international units for 3 days, then back to 5,000 of vitamin D. Vitamin C, 1 gram an hour until you start getting loose stools, and then cut it back. Glutathione, regular dosage, no sugar. And then also, one of the things you want to do is keep your body warm. What do we do? Everywhere you go, what are people checking for now? Their temperature. If the temperature goes up, it's because the viruses are in the body, and the body is raising the temperature to help facilitate killing off the viruses. Viruses are proteins, and they die at high temperatures. The coating around them, the fatty layer around them can start to dissolve, and then the RNA denatures, it's called. But hot baths, hot showers, steam showers, hot drinks keep the body really warm. But keeping the immune system strong regularly. Now, also, next week, we're going to have in something called Dr. Joe's Wellness Booster. Next week or next week? 2 weeks.
I think by the end of the last week of October is when we're supposed to get it.
We're going to have the magic bullets coming in. Dr. Joe's Wellness Booster and Dr. Joe's Seasonal Tonic. Now, these are my secret recipes. I created the Wellness Booster. It's echinacea, pau d'arco, and olive leaf extract, and suma root. And what that does, it stimulates your body's immune system. So if I start feeling, I take that every day in the winter. I take about a half a dropper full. If I start feeling under the weather, I'll take it every hour. Then the Seasonal Tonic. Seasonal Tonic, it's interesting when we created this. Ginger, horseradish, cayenne pepper, onion, and garlic pureed in apple cider vinegar. It tastes the way it sounds. Very, very strong, like a really strong salad dressing. But boy, if I'm feeling under the weather, I'll take 3 or 4 dropperfuls of that every hour, and it works amazing. And I've had pilots and flight attendants who travel a lot. And again, when you travel, oftentimes you get sick. They're like, Dr. Joe, as long as I'm taking a wellness booster and a seasonal tonic, I'm not sick anymore. Now, I can't promise it's going to work for you, but it works for a lot of other folks as well. So we have the supplements lined up on the website, drjoe.com. The only supplement we don't have is the liposomal vitamin C. You might have to get that online. But Super Green Essential Source, vitamin D, glutathione, and digestive enzymes, lots of raw foods. Everything's kind of tying together today. Chances of you getting sick drops dramatically, and then certainly keep the body hot. So
We also have the new immunobiotic, which is the probiotic that is...
That's right, specifically for the lungs. So if you have lung issues, coughing, scratchy throat, the immunobiotic is something else we'd want to throw into that protocol as well. So we have a lot of supplements for the immune system because it's probably the number one thing people ask us about. And so that's why they're all on the website. And it's pretty cool. It works really well. And if it didn't work, I'd find something else to take. I mean, I'm just like you. I'm exposed to new viruses, germs, and bacteria too. And so what do I got to do to stay healthy? These are little tricks that I do, and they work real well. So now you're kind of on the inner circle now. So what else? Quickie. Got a quickie or?
Yes. Let's see here. Any tips for someone struggling with hair loss?
Hair loss, yes. PRP. This is the coolest thing ever. We have PRP now available in the office. And what we do is we take your platelets, we take your blood, spin it down, take the platelets out. It's called platelet-rich plasma. And we can take the PRP and inject it back into your scalp. Now, it doesn't happen right away. It takes about 2 or 3 months. But a lot of people have seen amazing results with the PRP for hair loss. Now, we do want to work on your diet. You want to keep the immune system strong, the thyroid strong. We can do a hormone test on you to make sure your testosterone levels are where they should be. I do recommend we do that. But the PRP for hair loss is really cool. And it seems to work really well. And it's a lot less expensive than hair transplants. And we're using your own cells, which really makes it beneficial. So the PRP is really coming into its own now. And my goal is to make PRP just commonplace. Because it works so well for arthritis, arthritic knees, arthritic shoulders, spines, tendons, tennis elbow, wrist issues, carpal tunnel syndrome. Again, not everybody's going to get amazing results, but most people do. And it's way less expensive than injections and somebody else's cells or baby cells or anything like that. So it's a lot less expensive there too, because we're using your own cells. And we can do it right here in the office. You don't need to take a day off work. You don't have to have somebody drive you. So it works really well. We're also seeing a lot of good results reading the research on erectile dysfunction and PRP. So that's another thing we can add to our repertoire of PRP. So PRP, like when I created Super Greens and Essential Source, I said, okay, we found what I would consider the entry level for supplements. There's other supplements as well, but this is the minimum supplements people should be taking. That's on the website, drjoe.com. When it comes to regenerative medicine, this is where PRP comes in, and keeping the body young and healthy and helping the body regenerate. You're not going to be 16 years old after getting a PRP shot, but it's pretty amazing, the results. So if you do want to make an appointment, got to go to break real soon. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We only do the PRP in the Marietta office. You can book an appointment right online, drjoe, drjoe.com. You can book it right online. As soon as you book it, within a day or so, my staff is going to call you, give you all the details, discuss, make sure you got directions, discuss insurances. If you've ever been in a car accident, ever, if the car was damaged, you were damaged, you need to come see us as quickly as possible. The insurance companies play this little game where they say, well, you didn't go to the doctor like right away, so you weren't hurt. I had one lady, her father died, and she was coming to see us. She went to bury her father, came back 2 weeks later, the insurance company denied the claim. I mean, it really was a battle we had there. So you want to come see us as quickly as possible. Everyone in the car needs to see us. And normally the first visit, not car accidents, that's separate, but a regular health wellness visit for chiropractic, we do an exam, x-rays, consultation, first adjustment, and then the second visit, we go over the x-rays and do a nutritional workup. Normally the cost of that is $375. We've reduced that to $149. And then future care is covered by most insurances. So if you want to make an appointment again, drjoe.com. Folks, I'm Dr. Joe Esposito. Don't go anywhere. We're going to be right back. Hey folks, welcome back. Dr. Joe Esposito here. If you're just joining us, I'm glad you're here. I appreciate you spending time with us. What we're doing today is one of our frequently asked question shows, and we get a lot of questions from you, the listeners, on drjoe.com, our website. And of course, when we do our live radio shows, people call in with questions, and people send it through the live streams that we do a lot of. And so we pull questions periodically. We might want to do this, Garrett, maybe more often, maybe even once a
Maybe
month.
once a month.
Yeah, I like this is a fun thing because everybody has these same questions, and so we will, and we can do for our Sunday night show too. Why not? Yeah. And we'll go ahead and answer questions for you guys. So if you have any questions, you can go to our website and search the website, first of all, because chances are we have an answer for you, drjoe.com. And if you don't find the answer there, or you just don't listen to me, you can go ahead and send us the question through the website, and then I will say this is where it is on the website, or Garrett will, or Sarah will, or Joe will, or whoever, somebody who's answering questions for us. But so this show today, we're answering questions that people have sent in. So we have Garrett and Sarah here with us today, and who's next for the question?
I think it's me.
All right. It's always you, isn't it?
It's always me.
Even if it's not you, it's still you.
Yes. Garrett should know this by now.
Yes. Listen to her, Garrett. What's wrong with you?
What are some tips that you have for going vegan?
Going
And
vegan.
if anybody's watching our stream right now, share some of your tips.
Okay, that's a good idea. Yeah, because we live stream these folks. Oh, by the way, that's a good point. We live stream our shows, so if you're not doing it now, if you're not doing it yet, you need to follow us on Facebook and Instagram. It's at Dr. Joe Esposito. And I always say, we give you all this information for free. We answer your questions for free. Your cover charge, there is a fee. Your cover charge, you got to follow us on Facebook and Instagram. I think that's pretty reasonable cover charge for all this information you're getting. We have doctors and medical schools, chiropractic schools all around the world air these shows as classes. So you guys are getting postgraduate information for free. But the cover charge is follow us at Dr. Joe Esposito, Facebook and Instagram. That's all I ask. And then you're in. You're part of the cool kids then. So going to a plant-based diet, and there's a difference between vegan and plant-based. So let me cover that first. Vegan is you don't eat any animal products. But you can eat breads and cookies and cakes and donuts and pastas and chips and fried foods. And you can eat very poorly and still be vegan, because vegan by definition is no animal products. Plant-based is no animal product. Actually, some people say you can have animal products. But plant-based is mostly whole foods. What I mean by whole foods is the least processing available. So if you have lettuce, that's great. That's very low processed. But if you have, soup, let's say, it's been processed. A little more, still not bad. But then when you start having, let's say, chips or things like that, that's super processed food. So you can take corn, organic corn, and then grind it into a corn meal and then fry it. Now you get into super processed foods. And that's now no longer plant-based. So plant-based is mostly fruits, vegetables, nuts, and seeds. So how do you do that? Go to our website, drjoe.com, and type in the search bar, so what can I eat? And we do a whole hour on the show of what to eat. Breakfast, lunches, dinners, snacks, parties, raising kids. We cover it all. Now, my book, Eating Right for the Health of It, is also an excellent guide to going plant-based. And the first half of the book tells you how to change your diet. And the second half of the book is well over 200 recipes. And by the way, if you follow us on Facebook and Instagram, sometimes Garrett gets really sneaky on me, and he will send out a code or something like that and give you a free copy of one of our books, the digital version, not the hard copy. So by following us, there's a lot of benefits to that, and sometimes Garrett does stuff he doesn't tell me, and he does things like this. So it's another benefit to follow us on Facebook and Instagram. But at Dr. Joe Esposito is where you follow us. Eating Right for the Health of It, great guide. So what can I eat? A great guide. Let's go through a day in a life. Dr. Joe, what do you eat? I hear that all the time. I want to eat what you eat. And a lot of the supplements I created, a lot of the foods I created, a lot of recipes I created were people saying, what do you eat? So this is how I eat. It's very simple. Start out your day with super greens and essential source. You have to start your day with that. That's like for many people, it's coffee. It's their burst of energy. A lot of people have given up coffee and stimulants because the super greens and essential source works so well. I personally take super greens and essential source, omega-3 fatty acids, because most of us are deficient in omega-3s. B complex, glutathione. I take men's hormone support because as I get older, my hormone levels are dropping. I want to boost my hormones a little bit. I take estrogen regulator, which prevents my testosterone from converting into estrogen. I take digestive enzymes if I am eating a cooked meal. And so that's how I start my day. A handful of supplements, super greens, and essential source. Does not fill me up. I like breakfast. Some people skip breakfast. I'm okay with that. I can skip dinner. I can't skip breakfast. So then I'll have some fruit usually. Whatever is in season I'll have. And then I'll start my day. I'll get going and I'll start, shower and shave and get everything ready and get my clothes together and everything. Sometimes I'm okay. Sometimes I'm hungry. If I am hungry, then I'll have a little snack. Sometimes I'll have whatever was left over from dinner last night. I try to have something raw, of course. Salad usually works. Right around 10 o'clock, I'll start to get hungry. And I don't get hungry, I get shaky. I'll notice I'll be talking to a patient, my hand will start to shake. I said, oh, time for food. So then I usually have several different types of nuts and seeds at my office in my desk. Yesterday I had pistachio nuts, sometimes cashews, sometimes walnuts, sometimes almonds, and then I'll have that. Lunch is almost always a salad. Salads are easy, quick, and cheap. Now, if you have a honeymoon salad, Sierra, what's a honeymoon salad?
Lettuce alone.
Lettuce alone. There you go. Sierra's least favorite dad joke. You can have a honeymoon salad, lettuce alone, but that's kind of boring. So shake it up a little bit. You throw in some cut other vegetables, peppers, onions if you want to, if you're not breathing on people. Carrots, you can shred up some carrots, celery, throw it in there. Throw in some nuts or seeds. Throw in a can of chickpeas, maybe organic, of course, organic red beans. Put that in there. You could use nutritional yeast, which really gives it a very good savory flavor. If you're a headache sufferer, nutritional yeast is high in glutamic acid, which is glutamate, which can trigger headache. So just be careful with that. 99% of people don't have a problem with it. Great source of B vitamins and amino acids. And then have that as your salad. Then for dinner varies. Sometimes I skip dinner. Depends if I'm going out to dinner, if I go home for dinner. But in my book, Eating Right for the Health of It, we have over 200 recipes, and we have a lot of dinner recipes in there as well. So it's not hard to do. It's very easy. It's simple. It's way less expensive than anything else you're doing. I'm amazed. I bring my lunch every day to work unless I have a meeting to go out to for lunch. Other people buy their lunch. And then I see lunch is $8, $10, $12, $15, $18. It's a lot of money. So you're going to save a ton of money by eating plant-based, bringing your own foods. You know the food is quality. You can pick what you want. You don't have to worry about monosodium glutamate or somebody spitting in your food or whatever it is. So there's no downside to this. Hummus is great. A lot of times I'll have hummus, and hummus is so easy to make. Chickpeas, tahini, a little bit of olive oil, lemon juice, salt and pepper, throw it in a food processor, whip it up, it's done. You could add olives to it if you want to get crazy. You could add roasted peppers to it if you want to get crazy. And then you could eat it with cucumber chips. You could have regular chips if you want to. Not the best food, but okay if they're organic. I prefer you don't have them fried because the frying creates trans fats. So there's tons of different foods that you can eat, and I've never missed a meal. I've been plant-based now 34, 35 years. I've never missed a meal. I get invited all the time. In fact, Garrett was just telling me this week, we're getting invited back to corporations to start doing workshops and wellness workshops. So I've never missed a meal anywhere I go. Cruises, flying anywhere, traveling. There's always something you can eat. So it's not hard to do. It's pretty easy, but all the information's on the website. So what can I eat? Boy, that was a long answer. Next question.
Next question. If I live out of the area, how do I find a good chiropractor to trust or that I can trust?
Gosh,
and another way to word that would be, what should I look for in a chiropractor?
6'1", Italian? No. Oh, that's me. Never mind. That's a really hard question, actually, because I get that question a lot. Dr. Joe, I want to go to somebody who does what you do in Illinois. I don't know who does what I do in my hometown of Marietta, So it's a tough call. So what I usually do is I'll tell people to ask around. I like somebody who knows how to do applied kinesiology, which is muscle testing. I usually find that doctors do applied kinesiology, kind of dig a little deeper. Is the doctor trained in nutrition? And that's kind of what I look for. But the best thing you can do is ask your friends. Ask your coworkers. Who do you go to? Who do you trust? And so many times you'll get a good recommendation that way as well. Unfortunately, I can't be everywhere. In fact, I only see patients out of our Marietta office, Duluth, Stockbridge, and West Cobb. Our doctors are all highly trained. And I mean this when I say this. All my doctors that work with me are as good or better than I am. So technically, they're amazing doctors. They're trained by me. They have their own skills. But here's the thing. They're my doctor. If I don't trust them taking care of me and Garrett and Sierra, I don't trust them taking care of you. So you're in very good hands with our staff. But if you're outside the area, I'd say start looking around, and you could ask about applied kinesiology and nutrition. Those would be the best advice I can give you. So, what else we got on our frequently asked question show?
What do you recommend for people in their recovery process, both pre and post-op, for any kind of surgery?
That is an excellent question. What do you do for people that are going into surgery and coming out of surgery? In my fantasy world, where I'm Surgeon General and Grand Poobah of the universe, everyone would have to do a very strict nutritional protocol. I would probably say 4 weeks before surgery and 4 weeks after surgery. We would save so much money healthcare costs would plummet. First of all, if they did this originally, they wouldn't probably need a lot of this services. Now, I'm not against surgery. Believe me, I've had surgery. I'm not against it. But if we took care of ourselves, we wouldn't have to spend all this money on surgery. But if you are going in for surgery, if you prepare yourself, chiropractic care, absolutely positively, no matter what the surgery is, you've got to get the nervous system working the best it possibly can. You want to go to a plant-based diet. You want to stay away from alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. You've got to stay away from these foods so the body has the nutrients that it needs to heal. I believe, totally my opinion in this statement, I believe that our death rate would drop significantly. The cost of healthcare would drop dramatically. And the outcomes would be much better if we do what I'm about to say. So, fruits and vegetables, nuts and seeds anyway. That's what your diet should be. Super greens an essential source, certainly. That goes without saying. Vitamin D to build the immune system. Digestive enzymes if you're eating cooked food. Glutathione to keep the liver healthy. Because pre and post surgery, many times there's medication involved. And the medication is always going to end up in the liver. You've got to do everything you can to get the liver to heal. There's also a supplement I may recommend called milk thistle. And we don't carry it on the website, but we do carry it from a company called Standard Process. And milk thistle is amazing for cleaning out the liver as well. So, fruits and vegetables, nuts and seeds, raw food, chiropractic care. If you have digestive issues, let us take a look, see if we can fix the stomach, hopefully before you go in, so you can absorb your nutrients. And then the anesthesia alone is a challenge. Sometimes people do very well with the surgery, but they don't do well with the anesthesia because it shuts down your brain. That's not good. It is if you need anesthesia, though. So we got to get the brain working normally again. And if you're eating saturated fats, meats and dairy products, fried foods, artificial sweeteners with aspartic acid in there, or glutamic acid, that'll cause the brain to fire faster than it's supposed to. You've got some real serious issues going on here. So we think about surgery, I go, let's go and chop you up and we're done. I feel that if we prepared before and after, we get way better outcomes. And so that's what I would suggest. And again, listen to the 7 Deadly Sins of Nutrition on our website, and So What Can I Eat on our website. Follow those guidelines, and in most cases, you're going to do a lot better. And that's always my goal, and I've tried. But we get quite a few referrals from surgeons saying, Dr. Joe, I want you to get this person healthy before I operate on them. They're too sick, they're overweight. We put them on a 21-day doctor-supervised weight loss program. Dr. Joe, we got to do everything we can to get this person healthy. Those are the doctors that I refer back to, because they understand that this isn't just about, slice and dice. It's about getting the person well. It's not just treating a number, it's treating a patient and a person. So those are the doctors that I like to work with, the ones that have that awareness. So that's a real good question, but that's what I would do if I was going in for surgery. Next.
What's causing my bad breath?
What's causing bad breath? Very, very common. How many people know somebody with stinky breath? Raise your hands. Okay, Sierra raised her hand. And she's looking at Garrett.
I'm not talking about Garrett.
Okay, good. Garrett and Sarah, by the way, date. So in case you don't know that, in case you're a new listener, that's why we play here. And Maggie's our office mascot, the dog. And does Maggie have bad breath?
A little bit.
Really? Her breath isn't that bad. She went to the vet the other day, and they said that her teeth were actually really good.
Good, because she's eating good foods. That's why.
She's spoiled.
That's because she's spoiled, right, exactly. So bad breath is usually caused by one of two things. One, it's a rotten tooth. There's something in the teeth. Now, I had an issue one time a while ago, and I couldn't figure out what it was. I ate a good diet, and I brush and I floss, and I was water picking. And I went to the dentist. He took an x-ray, and a little piece of food had lodged itself against the side of my tooth, and it calcified. As soon as he popped it out, breath was fine. So if it smells like rotten tooth, okay, and you might know what that smells like, it's probably an oral thing. May have to go to a dentist. If it smells like a dirty bathroom, and we know a lot of people that have that problem, that's a bowel problem. Because what happens is anything in your colon can be absorbed into your blood system. So if you have really bad gas and rotten food in the colon, the gases can get absorbed into the wall of the colon, into the blood system. Those gases go to the lungs where air and oxygen and other gases are exchanged, and it comes out through your lungs. So you can brush your teeth all day if it's coming from the colon. So in cases like that, we have to look at, do they have acid reflux and heartburn? We may have to physically pull the stomach away from the diaphragm. Do they have constipation? They're eating a lot of meats and dairy products. The food is rotten in their colon. Are the bowels moving properly? The bowels should move once or twice a day minimum. We might want to get them on Dr. Joe's intestinal cleanser to get the bowels moving. We want to change their diet up a little bit. Chiropractic care is important because the nerves in the low back control the colon, the sex organs, and the bladder. So we may have to adjust them and open up the nerve and blood supply to the colon to get it working. But bad breath, it's a really good question, is a symptom. It's telling you that something's wrong. And so just ignoring it or covering it up is not a good thing. One of my friends actually had such a rotten tooth, I couldn't go near the guy. This is years ago. His breath stunk. And I don't know how anybody went on dates with him. I mean, it was just awful. And then one day he started having a pimple on the bottom of his chin, and it burst. And it was all infected. His whole lower jaw was infected. And so they had to go in there and scrape out the infection, and that's where the bad breath was coming from. But I told him many times, your breath stinks. He's like, I don't know what you're talking about. But it was a sign that there was a rotten tooth in there, and that was really important to find. So depending on what it smells like will depend on where the problem is. But if it's a potty smell, it's usually, we can do wonders, many cases, not all, with chiropractic and nutrition and fixing the gut, which is important for many other things as well. So, next question.
Oh, I'm sorry. I was not paying attention. Sometimes my jaw pops when I eat. Is that bad?
Yes, as a matter of fact. Your jaw has nerve endings in it called...
Pay attention to this one.
This is Sierra. She's got to pay attention to this one? Okay. You want to tell your story, Sierra?
I can. I was in a car accident, I guess about 3 years ago now, 3.5 years ago. It was like front impact, and the airbag hit me in the face and did a lot of crazy stuff to my jaw. I went to a TMJ specialist for a while, and they recommended me to a surgeon, but I did not want to have a surgery with a 9 to 12 month recovery in regards to my job. So I started going to chiropractic care, and through all of the amazing chiropractors, because I've seen every single one of them at Dr. Joe's office, they've all been helping me to maintain my jaw, and I haven't had any issues since.
There you go. So yeah, popping jaw, like in Sierra's case, was extreme, but a popping jaw is a warning sign. It's telling you that there's a little pad in the jaw. The jaw is a hinge joint, and the little pad in there has come out of place. Now, there's, and don't quote me on this, I may be wrong, it's been years since I knew this, 32 pair of proprioceptive fibers in the jaw, and 31 pair in the sacroiliac joint. So proprioceptive fibers tell you where you are in space. So I can't see the food that I'm chewing, so I have to know where the food is. So I have a lot of nerve endings in my jaw telling me move the food here, move the food there, chew here, don't bite your lip, don't bite your tongue. And so the proprioceptive fibers work really well to keep your body safe. The ones in the hip control balance. So many times when patients stumble, if they fall off balance, if they're awkward, they're clumsy, it's a sacroiliac and or a temporomandibular joint problem. It's affecting the proprioceptive fibers. So we can chiropractically adjust the jaw, like Sarah was saying, adjust the sacroiliac joint, reestablish the connections in the proprioceptive system, and amazing because it's not only feels better, but it allows the person to be safe. They're not as clumsy, they're not stumbling. And this happens a lot with seniors. I've taught many seminars on risk management when it comes to falling. And so it could be the sacroiliac joint, it could be the proprioceptive fibers, it could be the cerebellum, the back part of the brain, because balance is controlled by the proprioceptive system, the cerebellum, and the inner ear, the semicircular canals. And so if there's damage to any one of those, that can cause, that's why we have dizziness and off balance. So in fact, we just had a patient the other day, and Dr. Irwin and I worked on the patient together. An older woman kept falling to one side, and so we found she did have a cerebellar injury, lesion we call it. And so we adjusted just the side of her body, just the left side in her case, where the cerebellar was lesioned, and her balance got better almost immediately. And now it's going to be an ongoing process. It's not a one and done, but we want to be able to fix that. So popping of a jaw, chiropractic care in many cases should be your primary entry point. And then we got to check the sacroiliac joint, because if that's out of place, you may not hold the adjustment in the jaw. So I know it's a little complicated, but it's a lot of neurology I just taught you, but we've got to get the nervous system and neurology balanced, and that's what we do in our offices. We work on the nervous system, the digestive system, and the diet. So, next question. Almost out of time here.
What are some tips you have for pregnant women to stay healthy through pregnancy?
Absolutely, positively, no artificial sweet, none of the 7 deadly sins. So again, if I was Grand Poobah to Universe or Surgeon General, this would be my rules. 7 deadly sins nobody should eat, especially women that are pregnant, because it's not about you, it's about you and the baby. So like things like monosodium glutamate can really irritate the baby's nervous system. Aspartic acid can do damage to the baby's nervous system. You have to stay away from mercury. That's fish. Okay, if you're in California, tuna cans and fish cans have warnings on them for pregnant women. because mercury, if it gets into the body, can short circuit the brain. And there's a lot of research out there on mercury and brain shortages and short circuits, Alzheimer's, Parkinson's. So many times it's a mercury issue. So I would say absolutely a plant-based diet just to be safe. Organic, so you don't get pesticides and herbicides and chemicals in the baby and into you. A lot of water, supplement-wise, Super Green's an essential source, which, by the way, everybody should be taking anyway. They're 2 powders. They taste great. We have mint flavor. We have regular, by the way, in these Super Greens. So I like the mint flavor. I like things a little sweeter. Some people like a little calmer. That's the plain. And then we have the essential source. I can't imagine a day going by not taking that. And if you were pregnant, especially, and breastfeeding, even more important. That you should be doing that. So supplement-wise, vitamin D, of course, you got to keep the immune system strong. And your immune system is the baby's immune system. Your body is the baby's body. So here's a simple question you could ask yourself. If I'm going to eat this, would I feed it to my baby? And if the answer is no, then you shouldn't eat it yourself, because the baby shouldn't be eating what you wouldn't be eating. So a lot of fruits and vegetables, nuts and seeds, plant-based diet. There's no reason why you shouldn't be taking care of yourself. Now, many times with pregnancy, you need chiropractic care as well, because as the baby grows, it spreads the hips out, and that can throw the sacrum out of place. And the sacrum is attached to the uterus by something called the broad ligament. So if the sacrum rotates, you can pull on a broad ligament, which can pull on the uterus, and we don't want that if you have a baby in there. So I would say that every pregnant woman should have a chiropractic evaluation, absolutely positively. And then after they have the baby, you got to get things realigned as well so that it heals, because the ligaments are going to stretch and move the joints around to make room for the baby. You got to get things realigned so when the ligaments tighten up again, they tighten up normally and not crooked. So we see a lot of pregnant women. There's even an adjustment called the Webster technique that my doctors are trained in that has been shown to sometimes turn a breech baby. Not always, but sometimes. Really cool technique. And I studied with Dr. Webster. I studied with a lot of greats because I'm old. And so, and they're not around anymore, but I am. And I took all their knowledge with me. So if you do have a health issue, folks, if you want to make an appointment to come see us, neck pain, back pain, shoulder pain, headaches, numbness, tingling, carpal tunnel syndrome, stop suffering. Stop saying, oh, it's going to get better, I'm going to try this. Just come see us. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. The initial visit for chiropractic was $375. Through COVID, we've reduced that price to $149. That's an exam, x-rays, consultation, first adjustment, the second visit going over the x-rays, putting together a treatment plan for you, and doing a nutritional evaluation. After the first visit, and we go over everything, most insurances we accept. We work with car accidents, sports injuries, workers' comp, Medicare. There's no reason why you should be suffering in most cases. You should come see us. So you can make an appointment right now online, drjoe.com. It's real simple. My staff will call you once you do it, and we'll give you all the information, directions. If we have more advanced issues, we have arthritis, we have knee problems, we have shoulder problems, wrist problems, muscle injuries, we may want to go to our medical division and get some PRP. PRP is platelet-rich plasma. Platelet-rich plasma, and we take the proteins and we inject them back into your body to facilitate the healing. So it's your own cells that we're putting back into the body to facilitate the healing. It works wonders in most cases. And we talked about we can even use it for hair growth, facials, non-surgical facials. So a lot of amazing, erectile dysfunction, a lot of amazing things can be done with PRP. In most cases, not all, and no guarantees. So if we need pain management, we have our medical doctors on staff, hormone replacement therapy. We can check your hormones. We maybe do it with supplements, maybe do it with plant-based hormones. So there's a lot of things that we can do to get your body healthy. So I feel it's the ultimate in the anti-aging medicine field, getting chiropractic, nutrition, digestion, and then the medical portion to get you well and keep you well. Again, the website, drjoe.com. Folks, I'm Dr. Joe Esposito. Tell your friends about the show. Catch you next time.